The important thing you just mentioned was that if you're going to the right doctor, a vascular surgeon, he has at his disposal all options. So if there is something more involved.
Yes, certain physicians in the past may not be able to do everything with regard to varicose veins. They may be relying on other people to visualize the veins for them. They may not know the anatomy as well. And it's important to place these catheters in the right position. So mistakes can happen to anyone, but they're less likely to happen to someone who's fully trained in doing these procedures.
We're here today with Dr. Kerry Rifkin, vascular surgeon in Orange Park, Florida. Dr. Rifkin, I know that you've been practicing for a while. Could you give us some background on your vascular practice and experience there? Then we want to talk about some of the procedures that you routinely do.
Well, I've been in Orange Park practicing vascular surgery for approximately 30 years now. We've developed a large active practice. We do a variety of vascular procedures, and we're experienced and have been here in this community for quite some time.
Talk to us about some of the typical procedures that you do. And I say typical, they're often very involved, very critical, but can you describe some of them?
We often operate on the carotid artery, which is the artery in the neck, when disease can produce strokes. So we're very proactive in trying to prevent strokes as well as treating strokes when they do happen. We do a carotid endarterectomy procedure, which is very proven, relatively safe, and with few complications in the right hands.
And bypass surgery?
Frequently, people will have blocked arteries in the legs and elsewhere in the body. We'll have to do a bypass from one artery to another. This is done with the patient's own veins or perhaps with a prosthetic Dacron patch or bypass graft to facilitate the bypass itself, which is another very common procedure we do is bypass surgery.